what I'm going to ask him to do is just lie comfortably, and I'm going to use this arm. Do you have a shoulder problem?
No, sir.
You don't? Okay, so you don't mind if I use this arm and put some pressure on it? So what I'm going to ask you to do, brother, is your job is to keep your arm straight up and down,
Yes, sir.
and then I'm going to apply some pressure.
Yes, sir.
What I want to know is if you can lock this muscle in your shoulder. Okay, now you're trying too hard. Just match my pressure. My pressure right now is 0.
Yes, sir.
I'm slowly increasing it.
Yes, sir.
Now you just match it, okay?
Yes, sir.
Now that muscle locked, right?
Yes, sir.
So now what happens if I do this? His arm got weak. He probably thinks I pushed harder, but I didn't. Okay, let's try this side, brother. Now just match my force. Okay, now the muscle has locked and the muscle collapsed. Why? Because I switched him from the sympathetic branch of his autonomic nervous system to the parasympathetic side, and he experiences that as weakness. So now this is like a computer. A computer just is binary. It's a series of ones and zeros, right? So when he's matching my force, that's like 1, that's a 0. Okay? Now, let me see if all of his circuits are functioning, because the body is electrical. Put your thumb and little finger there, like that. Okay? The body is electrical, so now I have to make sure all his circuits are actually working. So match my force, brother. Okay, that's good on that side. You can put that down. Now put the thumb and pinky together on this side. Let's match my force. Okay, it's good on that side. So now we can actually test him. Now what I'm going to do is I'm going to use this arm as the indicator, and then I'm going to go throughout his body and test all the organs in his body to see which ones are strong and which ones are not strong. So now your job, remember, is just to match my force, and don't try too hard. Just if the muscle gets weak, it gets weak. If it gets strong, it gets strong. Okay? All right, so match my force. So I'm testing his brain now. Would you lift up your head?
Yes, sir.
Match my force.
Okay.
Cervical spine, head down. Okay, maxillary sinuses. Do you have a sinus problem?
Slightly, yes, sir.
Slight sinus problem.
Yes, sir.
Match my force. Okay, the upper jaw. Do you have some bad teeth there?
No, sir. Excellent.
You know,
All
all of them? Okay, you better check it now.
yes, sir.
Match my force. Checking the pituitary gland in the middle of the brain. The pituitary is right in the middle of the brain. It's testing weak. Can I undo your bow tie here so I can check your thyroid gland?
Yes, sir.
That's my force. Okay. Thyroid is okay. Lungs. Thymus gland. That's the master gland of immunity, right behind the breastbone. Match my force, brother.
Yes, sir.
You're trying to prove it's not.
I got a big heart.
Okay, so just match my force.
Yes, sir.
You're doing great. It is weak.
Yes, sir.
Okay, match my force again.
Okay.
The spleen is fine. The stomach is fine. This is weak. Gallbladder is fine. Liver is a little weak.
Yes, sir.
Match my force. Fine. Transverse colon, descending colon is weak. Bladder and prostate are fine. Kidney is weak. Adrenal gland is weak. On the right side. Match my force. Kidney and adrenal gland. Okay. I didn't write down all of those, but what was it?
Kidney was weak.
The upper jaw, pituitary gland,
Something in the middle of the chest.
the thymus gland, the heart, the liver. Okay, somebody wrote it down. Okay, So now, what I need to know, he has all of those things wrong. I have to ask the body, which one is the most important? I'm not smart enough to figure it out. You're not smart enough to figure it out. Your intelligence up here is not smart enough to figure it out, but the body knows. So what I need you to do, brother, is take your middle finger and put it in the crease of your thumb. So it's just like that. Now I'm going to ask the body, is it the maxillary sinuses? No. It was weak before, now it's strong. Is it the thymus gland? No, it's strong now. The heart? Heart is still weak. The liver's now strong. The pancreas is now strong. With the descending colon is now strong. Kidney is strong. Adrenal is strong. So the thymus gland is the one that remained weak. So it means that according to the logic of the body, even though all these other things are a problem, the priority is this thymus gland. Now, you can lay that down. Let me grab some. What actually could be wrong with his thymus gland? Well, it's either something external from the environment or something internal. So let's check and see whether certain types of foods might be affecting his thymus gland. Now, see, he's getting rambunctious here now. Just match my board. And it stays weak. No, I did test it. So if you notice, these are 7 major food groups, things like sugar, milk, eggs, corn, wheat, soy. It did not change the status of his thymus gland. Let me test him against inflammatory things that might be of an infectious nature. Now his thymus gland is testing strong. That's because there's something in here that would help his thymus gland. And I'm going to take a guess that maybe it's this one. It is. So this is something called Thymex, which is going to be a part of his treatment. Let me see if there's anything else in here that is affecting his thymus gland. And it's not. So Thymex is something that comes into play when a person has a bacterial or sometimes a viral infection, and in this case, it's affecting his thymus gland. Let's see if he is toxic in any way. So I'm going to test him against chemicals. And he is. You have a chemical toxicity. Let's see toxic metals. No metals, but chemicals. So let me see whether or not there's a way that we could detoxify you from the chemicals that are causing a problem. And yes, this is a whole food supplement that's called parotid protomorphogen. And what this does, it helps to rebuild the parotid glands that are called salivary glands, but guess what else they do? They help detoxify the body. So I don't know how old you are, brother, but he's 54. So usually when you reach this age, your parotid glands are exhausted from all of the toxicity in the environment, and his parotid gland needs a little support. Once we restore his parotid glands, it'll clean out the chemical toxicity that's affecting his thymus gland. The thymus gland, remember, is the master gland of the immune system. So if we don't do this, then this brother would be at a risk for developing some severe infection or even cancer. Cut it out. No, I think he needs that. So now we checked all of the external influences that could be influencing the thymus gland. Now let's look at the internal things that might help to make it stronger. And here's a second one called Thymus PMG that helps to rebuild it and see how strong he gets. Now you think he and I have made an agreement. I take that off of him. See how weak he gets? I put this back on him. I'm trying as hard as I can. I can't break his strength. I take it away. So what? And he's bearing with witness. He's saying it's powerful.